Have you ever heard of a procedure referred to as an upper endoscopy? Also goes by the name of the EGD. Have you known someone who has had one? Or are you even confused about what I'm even talking about? An upper endoscopy, or EGD, is pretty much where they use an endoscope, which is like a tube with a light on it. They go through your mouth, down your esophagus, into your stomach, and then that goes to the initial part of your intestine, which is called the duodenum. There are many reasons that you may have an EGD done. There are certain preparations that you may need to take before the procedure, and then also complications can arise from having this procedure done. There are 4 points I'm going to share with you. I'm going to tell you, 1, why you might have this procedure done. 2, I'm going to tell you what preparations may be needed prior. 3, I'm going to give you the possible complications from this procedure. And 4, I'm going to tell you a brief explanation of how this procedure is done. I will now take you through the reasons why you might have this procedure. You or someone that you know may have had this procedure performed at some point. I believe everyone should know the brief, basic information on this procedure. An EGD may be done if you're having certain symptoms, such as black or tarry stool. If you're having a low blood count, they can go in and see maybe where you're bleeding from. If you're having severe weight loss, nausea or vomiting, or any pain in your upper abdomen, they can also perform this to maybe figure out why, maybe see ulcers and so on. Certain medical conditions may also require the need for EGD, such as with cirrhosis of the liver. With cirrhosis of the liver, they go in looking for swelling of the veins in the lower part of the esophagus. Those can also begin to bleed. Those were a few reasons that why a person might undergo an EGD. There are certain preparations that are needed prior to this procedure. You're going to have to be NPO for 6 hours before. And NPO, some of you might not know, that's nothing to eat or drink by mouth. And sometimes even medications, depends. Some medications might need to be held, such as aspirin, Coumadin, any kind of a blood thinner, just because there is more of a risk that they might bleed. The physician also will explain the procedure to the patient and give them a brochure reinforcing the highlights of the procedure, and then they'll end with the patient signing the consent with the physician witnessing. There are complications that can stem from this procedure, such as infection, bleeding, perforation, which is tearing of the duodenum, esophagus, or stomach. They can also have a sore throat, maybe some painful swallowing for the next couple of days, but that will subside. Now that you know why you might need an EGD and some of the preparations and complications of it, I'm going to give you a brief explanation as to how they perform this procedure. This procedure can be done outside of the hospital, which is known as outpatient, or it can also be done while you're still in the hospital. They will be giving you a sedative through an IV to kind of relax you if that might be needed. They're going to be monitoring your vital signs to make sure that you're stable. They're going to place you on your left side of the X-ray table in a fetal position. The doctor might start by spraying a local anesthetic in your throat to kind of numb it. That way you're not gagging the whole time they're trying to go in. The doctor then passes the endoscope, which is that lighted flexible tube. They're going to pass it through the mouth into the esophagus, which will then turn into the stomach and then your duodenum, the lower part intestine. While they're inside, they can also take biopsies or samples of fluids or tissues to maybe figure out why you're having certain growth, or just get down to more of what's causing this. Also, if you have an obstruction, they can also remove that. The endoscope is then withdrawn and they take you to the recovery room for a little bit until you become alert and stable, and then you're either going to be sent home or you'll go back to your room that you came from at the hospital. I hope I've given you a brief insight on information of the procedure of an EGD. Today I discussed the basic information of this EGD procedure. I discussed with you why you might have one done, the preparations beforehand that you might need to do, also complications that can arise from this procedure, and how the procedure is performed. In conclusion, I hope I have given you a little bit of basic information on an EGD in case you might need to have one in the future.